Hi, I'm Lindsay Mabray, and tonight I'm going to be talking to you about pulmonary blood flow. Pulmonary blood flow in the upright lung is blood flow that progressively decreases from the base to the apex due to the linear distribution of blood from gravity, cardiac output, and vascular resistance. Gravity. Because blood is relatively heavy substance, it is gravity dependent. That is, it naturally moves to the portion of the body or portion of the organ that is closer to the ground. The average lung is about 30 centimeters from base to apex. The blood fills the lungs from the bottom to the top, and it is comparable to a column of water that is 30 centimeters long, and therefore exerts pressure about 30 centimeters of water pressure, or 22 millimeters of mercury, between the base and the apex. Because the pulmonary artery enters the lungs midway between the top and the bottom, the pressure must be greater than 15 centimeters of water to overcome gravitational forces and thereby supply blood to the apex of the lung. For this reason, most blood flows through the lower portion of the lungs. Poussey's law. Poussey's law is vessel resistance, which is the R, is directly proportional to the length, which is L, of the vessels and the viscosity, we'll call that an N, of the blood, and the inversely proportional to the radius to the fourth power. Because changes in the diameter and radius are directly proportional to each other, there are three primary factors that determine the resistance to blood flow within a single vessel: vessel's diameter or radius, vessel's length and viscosity of the blood. The most important is the vessel diameter. The reason for this is that the vessel diameter changes because of contraction and relaxation of the vascular smooth muscles in the wall of the blood vessels. Furthermore, very small changes in vessels diameter leads to large changes in resistance. Vessel length does not change significantly, and blood viscosity normally stays within a small range. We're going to talk about the three zones. In zone 1, it is the least gravity dependent zone. The alveolar pressure is sometimes greater than both the arterial and the venous intralaminar pressure. Under normal circumstances, the pulmonary artery pressure generated by the cardiac output is usually sufficient to raise the blood to the top of the lung and to overcome the alveolar pressure. Zone 2. In zone 2, the arterial pressure is greater than the alveolar pressure, and therefore the pulmonary capillaries are perfused. Because the alveolar pressure is greater than the venous pressure, the effective driving pressure for blood flow is determined by the pulmonary artery pressure minus the alveolar pressure, not the normal arteriovenous pressure difference. Because the alveolar pressure is essentially the same throughout all of the lung regions, and the arterial pressure progressively increases towards the gravity-dependent areas of the lungs, the effective driving pressure is steadily increased down the vertical axis of zone 2. Zone 3 is the gravity-dependent area. Both arterial and venous pressures are greater than the alveolar pressure, and therefore flow through this region is constant. And then this is just the hand-drawn illustration I did. It is just an illustration that covers what we just went over. This is zone 1, zone 2, and zone 3. And over here, remember that analogy that we talked about? If you took a column of water that was 30 centimeters of H2O, it would equal out. Where the bottom, towards the bottom, is more gravity dependent, so you have higher pressures. This is where you have the 30 centimeters of H2O, and then this area requires the least amount of pressure, so you also have less blood flowing through this. And as you can see down here, these are the arteries. This is the capillaries, because these, if you look, the vessels or arteries or capillaries and veins, they go from bigger and they keep getting smaller towards the end, except for the zone 3. Cardiac output is the total volume of blood discharged from the ventricles per minute. The cardiac output, also CO, can stand for cardiac output, is calculated by multiplying the stroke volume, which is SV, by the heart rate, HR, per minute to equal the cardiac output per minute. And so the equation, if you were to write out, is going to be CO equals SV times HR. Under normal circumstances, the cardiac output is directly influenced by blood pressure. Although the total blood volume varies with age, body size, and sex, the normal adult volume is about 5 liters. Of this volume, about 75% is in the systemic circulation, 15% is in the heart, and 10% is in pulmonary circulation. Over 60% of the total blood volume is in the veins, and about 10% is in the arteries. And the pulmonary capillary bed contains about 75 milliliters of blood, although it has the capacity for 200 mLs. Pulmonary vascular resistance is pulmonary vascular resistance, circulatory resistance, is approximated by dividing the mean arterial pressure, also called MAP, by the cardiac output. In general, the vascular resistance increases, the blood pressure increases in the pulmonary system, and there are several known mechanisms that changes vascular resistance, such as active or passive mechanisms. The pulmonary vascular system constricts in response to decreased alveolar oxygenation pressure. This mechanism can cause the right side of the heart to work harder, and that causes cor pulmonale. Pulmonary vascular resistance increases in a response to an acute increase in the PCO2 level. It is believed that the vasoconstriction that occurs is most likely due to the increase in the hydrogen ions, and the pulmonary vasoconstriction depends or develops in response to a decrease in the pH.